Social support can come from a variety of sources, and identifying all uses will allow us to accurately reflect on the relationships between the defining terms. Our purpose of conducting a concept analysis on social support is to clarify the meaning and define the terms of what social support is. We will also construct cases to define and expand the concept to gain clarity of social support. And next we will have definitions and defining attributes by Lori Desidy.
Social support is defined as the interactive process between at least two individuals in order to improve the health and well-being of each other. Social support is seen as a communicated process to reaffirm a sense of belonging, improve sense of self-esteem, and to increase confidence. Social support can be broken down into actual and perceived support. Actual support is what an individual receives from another person in terms of what is said, what is given, and what is done. On the other hand, perceived support is what the recipient believes he or she has been given. Defining attributes of social support give a broad insight and are frequent characteristics found within the literature. These are listed as emotional support, informational support, tangible support, and appraisal support. Emotional support involves provisions of empathy, love, care, and trusting. Informational support involves exchange of advice, suggestions, and instruction to address problems. Tangible support can be given as direct assistance, such as financial aid or services. And appraisal support promotes the aspect of self-evaluation by communicating information relevant to the recipient's needs. As we were reviewing the literature, we came up with our theoretical definition. Social support is an interactive process between at least two individuals with a goal to promote an enhanced state of well-being through emotional, tangible, informational, or appraisal methods. However, the outcome, depending on the recipient's desire and perception of need, may either be positive or negative in nature. Next, we're going to go into the case examples of social support, beginning with the model case.
A model case is a real-life example of the use of the concept and contains the defining attributes of the concept. An exemplar model case is a description or depiction of a situation, experience, or event that satisfies the statement, if this is not X, then nothing is. In our model case, patient AC, a 51-year-old male patient, married for 25 years and has 3 children. He's admitted to the hospital for coronary artery disease and is scheduled to have a CABG on tomorrow. Mr. AC is stating his concerns about the surgery and wishes to have prayer. The hospital clergy is called and is at his bedside praying and reading Bible scriptures with the patient. Patient AC states he feels better about the surgery since the minister has come to pray. He is self-employed and states things have been very slow for his business lately and that he's not been able to work because of his increased tiredness and shortness of breath. He states he only makes about $20,000 a year and can barely pay his bills. The unit social worker is called and took information from Mr. AC and told him he qualifies for financial assistance. Education is also provided to patient AC and his family so they will know what to expect post-operatively. Patient AC's wife and his children state they will be present 24 hours a day during his 6 weeks recovery to assist him. His family understands he will not be able to lift anything, push or pull with his arms for 6 weeks. Patient AC also understands he will possibly need brief inpatient physical therapy until he's able to ambulate without assistance. Mr. AC also reflected on his poor diet and realized his eating habits contributed to his current health situation. The hospital dietitian also educated the patient on food options for his new low-sodium cardiac diet. Mr. AC stated he will be compliant with his new diet and understands the risk involved if he continues his old eating habits.
Ready? Next, I'll be discussing the related case of social support. Related cases are similar but differentiated from the defining characteristic of the model concept. We found that in the literature reviews that providing an example of the related concept helps minimize any confusion towards the model concept. So we found that companionship was a term that was closely related to social support and is defined as the relationship of companions, otherwise known as fellowship. Social support is considered dutiful and objective, while companionship involves leisure time and other activities primarily for enjoyment. So in our case, Mr. BC is a post-op day 7 and is being from a cabbage and he's being discharged from the hospital. Considerably, his discharge instructions were going to be extensive rehab, and so home health was set up accordingly. So once he arrived home, the next day the home health nurse went to visit the family, and she found BC's family and friends there visiting with him, sharing stories, enjoying time together. BC appeared in good spirits, and like social support, companionship is important for BC's well-being. According to Lakey and Cohan, they propose that companionship leads to stress reduction, contributes to positive appraisal, promotes better coping abilities, and elevates self-esteem.
I'm Terry Britton, and now we're going to be discussing the borderline case. As you can see, the definition states a borderline case is found when the same word is used in a different context. By attaching the concept to a different meaning, the concept is further defined. An excellent borderline case for the concept of support lies in the term support hose. A client who is admitted to the hospital with congestive heart failure wears support hose daily to her lower extremities in order to promote circulation and reduce swelling in her ankles. The term support can be considered in this case as a means of holding up or providing help to the lower extremities as they are not able to provide adequate circulation alone. The case relates back to the model case in that the support given provides something that would not be in the same state of wellness on its own.
Now we're going to discuss the contrary case scenario. Walker and Avant states that a contrary case is an example of what the case is not to facilitate a better understanding of the defining attributes. So the case is going to be a 45-year-old woman who has been diagnosed with stage 4 breast cancer. This cancer has spread to her vital organs. The doctor tells her about this. She is astonished and asks the doctor, "What should I do?" He states, "Not very much we can do at this stage. Maybe we could have helped if we caught it earlier." The doctor tells the client he will schedule a follow-up appointment in a few weeks. The nurse, who is standing in the room, is fearfully looking at the client and asks her if there is someone that she can call or talk to for support. The client calls her closest family members for support, but they are unknowledgeable about cancer, and they just simply ask her, "How long did the doctor say will you have to live?" The client says, "I have no idea how long I will live or what I should do." This clearly is an example of all forms of social support neglected. The woman received no emotional support from the medical staff or family. She received very little informational and instrumental support from the medical staff, and absolutely no appraisal support to analyze her emotions concerning this diagnosis. Now Terry will discuss the invented case.
The invented case is not always necessary when defining the concept. However, it is sometimes useful as well as interesting to imagine. Walker and Avant describe an invented case as useful when examining a very familiar concept such as man or love, or one that is also so commonplace as to be taken for granted, such as air. Often, to get an accurate picture of the critical defining attributes, the concept must be taken out of its ordinary context and put into an imaginary one. Consider a toy named Buddy, who has just lost his best friend who has gone into high school. The other toys in Buddy's room notice that he's sad by himself without his friend. So every day the toys get together and play with Buddy so he is no longer sad at home. This is an example of an imaginary situation, but it also shows how support from the community and society can help in emotional support.
Next, I'll be talking about antecedents and consequences of social support. Antecedents must take place prior to the event or incident in order for that particular event or incident to occur, according to Walker and Avant. Concepts are influenced by the circumstance of its antecedent, but antecedents do not have the same meaning as the concept's defining attributes. Langford, Boucher, Maloney, and Lillis define three antecedents of social support as social network, social embeddedness, and social climate. A social network is the structure of social support interaction. Social embeddedness describes the interpersonal ties and relationships between the patient and his or her network, and social climate portrays the environment which promotes the exchange of social support. Consequences, on the other hand, are opposite from antecedents. Consequences are the outcomes from the concept occurring after the event or an incident occurs. They are useful in finding relationships among variables and also produce further research information. Outcomes usually support positive health behaviors, in turn leading to better health status. Consequences may increase patients' adherence to treatment, increase understanding of their diagnoses, reduce stress levels, improve health behaviors, and increase participation in health care.
Empirical indicators are used to represent concepts as variables in empiric research and are formed as an outcome of inductive research approaches. There are also specific and concrete identifiers of concepts. Empirical indicators are also actual instructions, experimental conditions, and procedures used to observe or measure the concepts of a theory. Our defining attributes will also help us to measure social support, and measurement can be done quantitatively or qualitatively. Qualitative and quantitative criteria can be used to operationalize or measure the concept of social support. The qualitative approach does not involve the use of numerical data, but uses sensory gain data from listening or observing to obtain information. Qualitative also recognizes patterns among observations. Qualitative data is used most often to answer questions regarding social experiences. A quantitative approach uses numerical data by using any type of study as long as the study provides quantitative data about the concept of interest. Although there is no clear or effective standard of measurement or definition of social support, there are tools to assist with measurement. The ISSB measures the structural and functional dimensions of social support. The SSQ provides structural and perceptual components of social support by asking the patient to provide a list of people who provide support and a rating of the support given. Thirdly, the perceived social support from family and friends measures an individual's perceived functional support, including emotional and informational support. And next we'll have operational definitions by Terry.
Social support can be operationally defined as a person or group of persons in a community who provide continual comfort and or help with whatever needs arise for a particular person or persons. The ISSB, SSQ, PSS, FR, and PSS-FA provide reliable tools for the purpose of this concept analysis. The operational definition of the concept provides a tangible, measurable definition of the abstract term. The concept support can then be measured and applied with reliability in research design. In summary, social support remains as an important concept in nursing. It is apparent that support improves client morale as well as self-esteem, whereby creating a healthy, healing environment. The cases discussed provide clear examples of the concept of social support. Social support is cited in many published works as it applies to nursing and other healthcare professions. This analysis shows the significance of support and how support can be defined and measured. It is imperative to grasp the importance of support. Not only is it a common term used, but it can change the measure of wellness in clients as well as members of the community.